medical evacuation from the cruise ship. Hi, my name is Valery, I'm a ship nurse, and today we will discuss about medical evacuation from the cruise ship. So unfortunately, sometimes the medical team are not capable to treat the person inside of the ship's medical center. In some case, we have to evacuate the person to the hospital on the land, because as I mentioned in one of my videos, that the ship's medical center is not the same medical center from the land. So we are here to stabilize the person, but in some case we are not able to treat the person. In that case, we will evacuate or disembark the person. There is a three way to do it. First one is by helicopter. Is one of the best, fast and easiest way to do it. If you are, especially if you are in US, if you are in Europe, there is not an issue, because the doctor called the captain saying that we need to evacuate the person. Captain is calling Coast Guard and coordinate with the Coast Guard. They are looking for the best option to do the evacuation. Normally it's a helicopter. So they are coordinate between the bridge on the ship and the Coast Guard. They send a helicopter. We will prepare the person. We will put on the stretcher. We will go on open deck. Okay, there is special area designated for the helicopter evacuation. If you will ever see the photo of the cruise ship, there is big letter H, helicopter. So that's the area designated for the helicopter disembarkation. So whenever is helicopter on the way, the medical team will bring the person to the staging area. The paramedic will go on the winch, on the rope down. They will take the person, they will tie the stretcher to the winch, and they will go up together. It's very fast, very simple. But unfortunately, sometimes a helicopter cannot arrive. For example, it's a distance. A helicopter cannot fly more than 100, in most of the case, more than 160 miles one way. So if the ship is more than 160 miles away from the helicopter location, then helicopter will not fly. Sometimes the helicopter cannot fly during the night time, okay? And sometimes the helicopter is not even flying because of the holidays. Unfortunately, this is the reality, and this is what we are facing on board. So in this case, we have to deviate the ship, so we need to change the route of the ship. Again, in coordination with the Coast Guard, we are looking the best possible port that we can go to evacuate the person. So as soon as they decide which port we are going, the ship's going full ahead, full speed, in order to reach the port as soon as possible. Sometimes the Coast Guard send the paramedics on the pilot boat to the ship. So we don't need to approach the port. The pilot boat coming, they fetch the person and they take care on the way to the land. But sometimes we are approaching the port and there is an ambulance on the pier who is waiting to pick up the person. In some case, in some country, that even the medical team from the land should go with the pilot boat together with a person outside, and after that hand it over to the ambulance which is waiting on the pier. Sometimes in some company, one of the nurse should go even in a helicopter. So they take you together with the patient inside of the helicopter and you are flying together with them. Unfortunately, this is, depends on the country, depends where you are located. Sometimes it can be really challenge because, as I mentioned, helicopters are not flying during the night, is not flying on the holiday, so many excuses, and we have to handle case. Sometimes we need the company to change the ports. We cancel some ports because we change the way completely, and we are not able to make it next port of call, so we have to skip one port, we have to cut the ports, and there is a lot of complication, but the human life is in priority. If you want to hear more about evacuation, more details, or any other thematic, just let me know in the comments. Other than that, thank you for your attention.